Hello, I'm Mabel Jong, and I'm here today with Dr. Norman K. Thurston, who is the Health Reform Implementation Coordinator from the Utah Office of the Governor. Dr. Thurston, thank you so much for being here today.
You're very welcome.
Well, Utah already has health exchanges in place in your state, and they've been there since about 2005. Was that risky going ahead with this plan despite all of the uncertainty on the federal stage?
Well, the reality is that we were so far along before there was an Affordable Care Act that it didn't make sense to pull the plug on all of the work that we put into it. So there wasn't really a risk in proceeding because we were already at a successful stage before it.
Mm-hmm. Now, the uncertainty that we're seeing with the Affordable Care Act, does that add a layer of complexity to what you're doing in Utah?
Absolutely, because the Affordable Care Act envisions a version of exchanges that's significantly expanded beyond what we currently do. And so there's the complexity of having to think about, okay, how would all of these things work together, but there's also the policy complexity about which of these things would we really want for our state, what's actually beneficial for our citizens.
I understand that it's been very successful so far, especially for the small businesses.
Absolutely. So we're about a year and a half into full operations, but we're really still in development phase. Because of the Affordable Care Act, we haven't been able to say, well, we're 100% ready to go and fully live. But even in development phase with no marketing budget, with no outreach efforts, we've insured over 6,000 people at this point. And so that's amazing that you can get that many people to come in without marketing, just in a test environment.
So what's the next step? What do you have on the horizon for more changes in that area?
So the next step for our small business exchange is to actually launch a marketing campaign. So we're working with a consultant right now to develop a marketing campaign. We want to drive business into this and get enough volume so that it's self-sustaining over the long run.
Okay. And do you anticipate having to adjust what you're already doing based on what happens in June when the Supreme Court does rule on this?
Yeah, I would say that's the million-dollar question, but it's more like the billion-dollar question. We have looked at the Affordable Care Act and the things that we would have to do differently, all of the features that we would have to add, and there's a lot of work to be able to be compliant with the Affordable Care Act that really add things that weren't in our original vision, and so that's taking time and energy away from things that we really want to get doing.
Okay, and what is your advice for other states who might want to go it alone?
States that want to kind of follow our path, the most important thing is don't reinvent the wheel. Don't go out and hire a whole host of programmers to come and build a system from scratch. All of the parts that people would need to build an exchange exist in the private market. There are companies that have already thought about all of the functions that need to be done, and you can just bring them in and plug and play, build it modular and build it from existing parts.
Great advice. Thank you, Dr. Thurston.
You're welcome.
I'm Mabel Jong. Thanks for watching.